Morning, welcome to Kalkstein Chiropractic. I'm going to have you come along on a new patient journey with a good friend of ours. Colin Marshall's coming in from Diamondback Brewing Company. He's one of the founders of Diamondback Brewing Company, and I also happen to know him from going to school in the area as well. So Colin's coming in with a shoulder complaint. He's an avid mountain biker. He's really active. He does a lot of outdoor activities, and I'm just going to have you come along with us as we go through a new patient journey and see how our process works here at Kalkstein Chiropractic here in Baltimore, Maryland. So come on.
We're all human. So.
Yeah, we are.
Hey.
Morning.
Morning. Good to see you.
Good to see you too, man.
Of course.
I'm excited for our podcast filming tomorrow night.
Yeah. It's all the rage right now.
It is. I talked to Corey. Okay. Corey's going to come by. He said he wants to just swing by and say
Coffee
hi.
Corey?
Coffee Corey.
All right, okay.
And so welcome. So we're going to go through just a new patient journey. Liam's going to be following around with us.
Cool.
And we're just going to kind of go through this process like anybody else would be coming through.
Okay.
So before we get started on the clinical aspect of your shoulder, we like to just kind of have a conversation about objectives and goals before we even move forward.
Sure.
Okay. Kind of get to know you a little bit more and understand why you're here.
Okay.
Right. So we like to phrase the question like this, where we take ourselves out of this moment now. We look 2 months ahead of time, right? And if we were to look back over the last 2 months, right? We were sitting together 2 months from now, looking back over the last 2 months. What happens during that time with our office that gives you an exceptional experience and meets your objectives and goals with us?
Just being seen in a timely manner.
Okay.
And then once we're seen, we actually start to have progress through the treatment,
okay,
and through the work that we do together, and we get to meet goals and expectations, and then ultimately be able to exceed those and move on to higher achievements.
Physically higher achievements for you. That's
Correct.
Kind of your goal? Okay.
Yeah.
Gotcha. So first off, you're busy, so it sounds like being seen in a reasonable time is important to you.
Sure.
And then you've got some goals personally with your shoulder, whether it comes to pain or even maybe performance that you want to hit, it sounds like, right? And you want to hit those goals, and then you want to talk about, okay, what's the next step? You're already kind of on the next step in your mind, it sounds like.
Right.
So that's exciting. To me, that's an athlete speaking to me, right? So getting back to those goals, do you have any concerns or fears with hitting those goals, or with your shoulder in general and your neck?
No, I think my only fear is that I don't hold up my end of the bargain when I leave this office for exercises that I need to do in between visits. That's the only thing that's the hardest
Nice
thing.
answer.
Yeah, I would say so.
You got to know your weaknesses, right?
Yeah, exactly.
Okay, nice.
Play to 'em.
I appreciate you saying that and being honest with me. And finally, so we hit your goals when it comes to shoulder health, and then we start to push those boundaries a little bit more. We start to get you stronger, or give you activities that allow you to become stronger, and make sure that there's a system in place that you're held accountable with, right? That's important to you. And then we're very professional with our meetings, right? We're quick, we treat you timely, and you're in and out so you can get back to doing what you want to do. So we hit your professional goals and your objective goals clinically. Now, what changes in your life if that happens? What's the point of all this? Why do you want that done?
To be pain-free.
Okay.
I mean, not that I go through my daily life with a ton of pain, but also to be able to act at a moment's notice that I want to jump out for a 4 or 10 mile run, or jump out on the bike for an hour, be able to lift a bunch of kegs if I need to for Diamondback. And not that I can't right now, but there are some hesitations in my life whether I'm going to have that pain, or I have that pain now and need to limit myself with my activity.
Okay. Yeah, we were at Diamondback Brewing Company last week, and I'm talking to Francis up top, and I look down into where they brew all the beer, these huge tanks, and I just see Colin zoom by on his mountain bike through the tanks, and I'm like, where's he going? Oh, he's going off to a mountain bike at the Tabsco. I was like, okay, that's how he gets out of here. He's like the Batmobile, just zooming out of the cave.
Yep. Don't say goodbye to anybody up top, just ghost him out the back. Yeah.
That's nice.
Yep.
All right.
Keep that killer mindset going out.
Well, thanks for sharing that stuff with me. I appreciate it. Now we got a little bit more of an idea of who you are, really. You've got a really athletic and competitive mindset, definitely off the bat, right? You're performance oriented, and you're also looking to be held accountable in a way as well. And that's, I think, primarily why you're coming to us, right? You want accountability as well as an experience that helps with the pain too.
Absolutely.
So I think that we can definitely provide that. We have the systems in place, but let's first take a look at you clinically, okay? And then let's talk a little bit about the history with the shoulder. Primarily you have some shoulder blade pain, correct?
Yeah, so it'd be like down the right side of the neck, top of the trap, into the scap, and then down the right shoulder.
Okay, and you've had a history of this, and you've had really a lot of success with physical therapy in the past as well. Recently, it's been nagging you. You mentioned July 4th that you had a little bit of an exacerbation.
Yeah.
What happened during that time?
I don't. It might have been the flight, some turbulence, some bounce. Could have been the biking that week that knocked it out. But once I don't know, it could have been actually getting to my in-laws, and then there was a little bit of stress pent up or something like that.
Okay.
But mostly, I can't pinpoint like one thing.
Sure.
I just know that it was such a flare up that you got to almost. There was no mobility in the neck to move freely. It was just you had to turn the whole shoulder to actually move with it because it was so stiff.
Okay.
Yeah.
Okay. Now that pain, does it stay mostly in the back, or does it come into the down the shoulder, down the arm at all? Does it come into the hands at all at any time?
No, it doesn't go past my elbow.
Doesn't go past your elbow? Okay, gotcha. And do you find that there's certain activities that give you relief? Is there something that helps you with the pain?
I think staying active certainly helps it. I don't know exactly what it is. It might be the blood flow or the loosening of it.
Sure.
Or just the relaxation, stretching, those sorts of things.
Good. So the reason I asked that, and I'll kind of share this with our audience, I want to know what's aggravating, what's helping it. Movement is helping it. So it's in nature, I know that it's mechanical, right? If movement is relieving some of the discomfort, it gives me another clue or gives me another idea saying, okay, this is a mechanical in nature. The pain that he's getting is mechanical in nature, right? There's a lot of things that can cause pain in the body, and the joints, mechanical joints, or the muscles, mechanical, right, in that sense, those can cause pain. So it gives me another clue saying, okay, look to the spine, look to the shoulder, and look to the upper back, okay? And that's the reason kind of I dig into those questions. Now, what hurts it the most? What you mentioned flying, I think on the exam form, sitting for a long period of time, does that aggravate your symptoms a little bit more?
Typing on a computer like this, like any sort of movement in which the shoulder is not is supporting itself, or like if you're leaning down on a cell phone like this, that tends to aggravate up the shoulder and into the neck like that.
Okay. Yeah. So when we sit, in general, there's more force on the spine than when we're standing, walking, laying down, right? When we sit with our body tilted forward, there's even more posterior stress on the spine. So just in terms of alignment, in terms of force dispersion, sitting is one of the will bring about symptoms a little bit more that are symptoms derived from the spine, right? So that tells me, okay, I need to look in the neck, I need to look in the upper back a little bit more if it's causing stress in that position. Now, you did mention some activities with your shoulders. When we raise our arms up in any position, especially over 90 degrees of abduction, we have to support the shoulder, which is a really mobile joint with muscles behind it, right? So the scapula is really important for stability, but also some of the muscles that are closer to the neck, as well as the neck and the spine itself. So think of the spine as kind of your foundation, and then everything is supported, and there's forces driven through that foundation, right? So if I am overusing my shoulders a lot, I am putting stress on my neck in a way. Most of the time it's good stress, but sometimes that stress comes out in pain, right? So another reason that I want to look at that interdependence, so the dependence between two structures, the shoulder and the neck, they're very closely linked. So whenever I have a shoulder complaint, I want to look at the neck, and whenever I have a neck complaint, I also want to look at the shoulder too. Okay, so we're going to get started with that process, and we're going to start with a posture exam. Then I'm going to take a look at your range of motion. And then from that, I'm going to do any any orthopedic tests that I would need to do. Okay.
Yeah.
And then we'll talk about options that we have here.
All right,
okay.
Cool.
So you can go ahead and stand up for me.
Yep.
And face me. And just relax. So the first thing I'm looking at is shoulder height. He's got a little bit of raised shoulder on the left side, so a slightly high left shoulder. His head tilts slightly to the right, not much. Now these are functional things that you can come in with, and they're all ever changing. So for me, these are just little clues to look into. Now this isn't like how you always are, okay? And when I look at his hand, his right arm is just slightly pronated. He has a little internal rotation on the right arm, just slightly. So I want to watch you turn your head now, okay? So turn your neck all as far as you can to your right or left, either one. Take me out. Good. He has full range of motion in the cervical spine. He is over 60 degrees of left rotation. It's really, really healthy movement in the neck. Now come to your right side for me. Good, and the motion is equal bilateral. He has good range of motion in the neck when it comes to rotation. Now go ahead and bring your head back for me. He has a little bit of pulling on the right side. It tells me that there might be tension on the right side. Is there any pain with this?
When I go back and feel it get really tight in the back of my neck right here, like especially up towards the ear.
Okay. So he has a plus right levator scap, upper trap. So I'm going to bring you back again for me. Good. And I'm going to rotate you toward that side. And I'm gently going to press here. Is there any pain when I do that?
Yep.
Where do you feel the discomfort?
Right here.
So right in the middle of the cervical spine, he's got pain on the right. So there's a positive compression sign on the right. What I'm doing there is I'm taking the joints, and they normally kind of sit in this nice area here. And when I bring it back, they get a little bit more close. And then when I rotate them towards that same side, they get closer. So if there's a joint that's a little irritated, or if there's muscle tension around the joints and causing those joints not to move as well as they should, then you might have a little pinching with that moment, okay? Now I'm going to just have you bring your chin down to your chest for me. He has full range of motion extension, okay? Good. 2 fingers flexion. So a little bit for his good mobility that he has in those other planes. You can come on up. Relatively speaking, his flexion is a little restricted. So I want to look at the fascia. I want to look at the muscles on the upper back and then in the shoulders. Something I'm already going to take a look at, but it gives me another clue towards that area. Right.
I get pull in my lower back when I drop down like that.
Without a doubt. And bikers are another thing. Bikers get really tense. They get tense in a long manner, so you can get tense in a short manner, or you can get tense in a long manner. So if you look at people that kind of are always in this position, but they're tight in their back, but they're long tight. Bikers tend to get tight long in the erector spinae group. So focusing on mid-thoracic spine and lower thoracic spine with bikers in general is like a no-brainer for sure. So we'll take a look at that as well. So he had plus tension in the thoracic erector spinae group. So now we're going to go ahead and take a look at some arm strength, okay? This is not for the shoulder, this is actually for the neck. So we're going to look at the deltoid muscle. So come on up in this position here for me. So I'm testing the strength of the deltoid muscle. I'm going to push down, hold strong. Good. Full strength, 5+ in the deltoid muscle. So his arms come up, and then I'm going to look at the bicep. I'm going to pull, hold strong. Hold. Good. Whenever you do muscle testing, and I'm going to push, hold strong. You hold that pressure and you give him time to give feedback through that muscle group. Good. Here. So he's a strong guy. I shouldn't be able to close his forearm down like that. Hold nice and strong. Hold. Are you right or left hand?
Right.
So he's right hand dominant, but he's weaker on his right tricep. So at that level of the spine, there might be a little irritation coming from the joints, and it's causing a little bit of weakness in the nerve. And he's got symptoms that are traveling in that same area as well. So cervicogenic pain has this pattern, right? And that's good because we're finding out where the source is coming from, right? It's a little disheartening for someone as strong as Colin to have that feeling for sure, but at the same time, it's like, okay, no, I'm getting closer to figure out what's going on. Let's treat it the right way. That's a good thing, right,
Sure.
to have in the long run. So I'm going to have him come up on his back. I'm going to palpate his neck next, okay? So I'm going to finish the cervical spine exam just so you can get a little bit of fluidity in the exam, and then I'm going to have him come back up. Normally I wouldn't kind of bring you down, bring you back up, but then we'll look at the shoulder after this. So come on your back for me. The table does all the work for you. You just relax, okay? It'll bring you down at the same speed every single time. Good. All right. And you can rest your hands on your stomach and just relax. I'm just going to palpate the neck. I'm just feeling for how the joints are moving in different ranges of motion while putting my hands on each level of the cervical spine, okay? So the first thing I'm going to do is very lightly bring him into extension. This kind of relaxes that posterior chain in the muscles and gives me a good idea of where you might have some tension in the neck, okay? So Colin wants to work for me a little bit. Sometimes when I see people that have a little bit of tension in their neck or they work really hard, these muscles kind of have a mind of their own. That's okay. So I'm just going to go ahead and put him in a little bit more extension to get him to relax. So really let the weight of your head fall here for me. Good. And let me pull you up just nice and easy. So he's a little locked up at C0, C1 on the left side. And when I bring pressure over the C5, C6 level, he has a little bit of lateral restriction in those joints. So when I bring them over, when I compress the joints on the right side, he might feel a little tension in that area, and he's feeling a little restricted when it comes to passive range of motion, where he's not doing anything, it's me doing all the work, but he still feels restricted. And this is a nice position for me to palpate first rib as well. And you can already kind of feel yourself, that tension releasing a little bit when I press. Little tiny cavitation in the neck, so a little tiny crack. But when I palpate over the first rib, he's a little locked up there as well, right? So that's a good indicator that I'm going to look at the shoulder again. Now, a lot of this stuff is new to you, right? If you have any questions as we're going through it, don't hesitate to ask, okay? I'm happy to answer those questions for you. You can step up for me all the way. Good. And then come on over here. So it's complex in terms of this connection between the neck and the shoulder, but at the same time, it's pretty magnificent that we can even do the things we do with the shoulder. Shoulder is pretty, it's one of the most extraordinary joints in the body in terms of the range of motion that you can have with it and the strength that you can have with it as well. So the first thing I'm going to have you do with the arm is bring your arm down in this position. This is just a simple empty can test. I like it because it stresses the rotator cuff and it stresses the deltoid for stability, and I see if there's any pain in the shoulder with this. So I'm going to press straight down, hold nice and strong for me. Where do you feel discomfort when I do that?
Here.
So a little bit on the posterior and medial deltoid, he's getting a little discomfort, okay? So I'm going to bring his arm into this position. This is a test for impingement. If the shoulder is rotated forward, if it's pronated forward, it sometimes can put some stress on the structures in the front of the shoulder, and we're going to look to see if that causes any discomfort for him. So I'm going to push down, and I'm gently going to lift up, nice and slow. Let me know if there's any discomfort with this. Okay, any pain with that in the front of the shoulder? No, so he doesn't have any impingement of the supraspinatus tendon. He doesn't have any impingement of the rotator cuff. Relatively speaking, that's a negative test, okay? I would say this, when he does it, the way that he stabilizes his shoulder, he's trying to use his upper trap to engage those muscles. So he doesn't like to stabilize with the shoulder muscles themselves, the rotator cuff muscles. He's trying to compensate into the neck. That can cause stress in the shoulder and the neck, and that can exacerbate the symptoms he's already got. So from a rehab standpoint, I want to go, okay, I'm going to make sure that we're knocking off stability, good stability work in the shoulder, good joint centration movements in the shoulder for your rehab. So that's a nice test to see just how you go to stabilize the shoulder joint, okay? All right, so the next test I'm going to have you do is just simple lift off. So I'll face this way so I can show you. You're going to bring your hand back here, and I want to see you lift your hand off for me. Good. And go ahead and lift off for me. Good. Is there any pain when you do that?
No, just tightness.
No. Okay, and then come into this area here for me. I just want you to push on your stomach. This stresses the anterior caps a little bit. Sometimes people with a little bit of AC joint or instability of the shoulder itself will have pain with this. Any pain with that at all? I'm not expecting it to be positive, but it's nice to check off the list, and it's nice to do.
A little bit of shoot, but like not.
More on the backside.
No, more like down into the
deltoid. Okay,
yeah.
Gotcha.
Yeah.
Again, I'm probably just stressing those muscles again. It's more of a test for anterior joint instability. Finally, I'm going to look at abduction. Abduction is a great test to do when looking at shoulder mobility, and it kind of gives me a lot in terms of how he moves his arm above 90 degrees, because that's where people get in the most trouble when it comes to hurting their shoulder or getting it irritated. Okay, so just stand right here for me. You're going to face this way. Right, and so nice and easy with your palm facing down like this. Just bring your hand up to the ceiling for me as high as you can comfortably go. Good, really good healthy range of motion. I'm going to bring you back down. Any pain with that first off?
No.
No. So we're going to do this again. This time I want you to keep the palm facing down this way. Don't turn it at all. Go all the way up for me. Good, and come back down. Any pain with that?
No, just tightness.
And you feel that tightness in this area here or in the outside of the shoulder?
Outside of the shoulder and also in the
lat?
Yep.
Okay. So a little tension, lat plus right lat. Okay. Let me see you do it on the left side. It's always good to compare side to side.
Palm out or palm down?
Palm down, just like you did last time. Good. When it comes to how he moves into that position, it's a little cleaner. So he separates shoulder from neck a little bit better. The scapula stays pinned down. He doesn't rise up so much on the trap. Just a little bit there, right? He's got a little bit of a pattern of doing that, and that can come from protecting the neck and can come from protecting the shoulder through movements. again, he's got a history of an injury in that area. He might be guarding in that spot a little bit too, and that can exacerbate symptoms from time to time. So in terms of where I think your symptoms are coming from, I think you have a little bit of referred pain coming from the C5, C6 area, and a lot of times that pain can be facet in orientation. When it doesn't pass down into the hand, I really don't think it's true discogenic pain, and we're going to treat you conservatively with dry needling around the shoulder, okay? We're going to do adjustments to the neck and the thoracic spine, as well as the shoulder, okay? And then we're going to teach you some really great exercises that you can do consistently and do as a prep for your workouts outside of here.
That's where I become accountable on that one.
Yeah, 100%. We're going to put you through a program, okay? And there's going to be phases, and you have to knock off those phases in order to get to the next one. And you don't get to the next one unless you do them correctly, and it takes work to do them correctly. Okay. So that's really what makes that system really nice, is that you have to get better at it.
Sure.
Okay, you can't just check the boxes at all.
Yep.
Okay?
Okay.
All right, so we're going to show you how we set up dry needling with Colin for his neck and his shoulder, and then we're going to show you how we do his exercises and adjustments. Nice. And then we're going to hang out tomorrow night.
Yeah.
And we're going to talk. I don't know what we're going to talk about, to be honest with you.
That's what a podcast is, just chat about a bunch of random stuff.
There it is.
Yep.
It's going to be a couple minutes, okay? So just grab some water, hang out in the waiting room real quick. Wow!
We got it. Keep the knees out.
We're going to get started with some dry needling on your neck and shoulder. So this adjusts, Colin, so wherever you'd like it to be when you get down, just let me know if it's too high.
You want me face down?
Yep, face down, and you can have this underneath your belt line. Give you a little bit lift on your low back, okay?
Okay.
And then I like to put my arms down by my sides, hands, yeah, just like that. Good. And then you let me know if you're comfortable. You feeling good here?
Yeah.
So the reason I like that we do so much soft tissue work is it gives me a chance to palpate and take a look at our patients a little bit more, especially when I'm able to get a full view of his spine, right? So I definitely want to make a focus of some of this tension here in his mid-back. And he was saying when he brings his head down, he's got a little bit of pulling through this mid-thoracic spine area, right?
Mm-hmm.
Now, our spine is a series of curvatures. The lumbar spine has a curvature. It's called a lordosis. Your thoracic spine has the curvature. It's a kyphotic curve. And then again, in the cervical spine, there's lordosis, right? Your sacrum is technically another kyphotic curve. So you have these. It's almost like a wave going through your back. The spine orients in a wave formation. The reason for that is, like arches, it's a very, very sturdy structure to disperse force. Remember, we were kind of talking about the spine being the foundation for upright movement, and this curvature really helps with that stability, right? So it's a really good thing. Sometimes when we stress stability in a certain portion too much, that arch can get a little bit bigger, right? We get a little bit more support in that area. We demand, hey, this be the center of stability, and sometimes we get a little bit of increase in kyphosis, or a little bit of increase in the stability or strength around that area. Not a bad thing, just something that we can make sure that we're working on any imbalances that we might have when it comes to where we're stabilizing throughout our locomotor system. So looking at the core, looking at diaphragmatic breathing, that'd be something that we do with Colin as well.
It's called alternative 90s.
So first, you work in layers when it comes to palpating. So first, I want to do muscles. I want to do fascia. I want to see how the tissue is moving in the thumb. I want to feel for any trigger points within those muscles. I want to see are these rhomboids really engaged and heightened. Do I have tension or pain in any of these tissues? Again, dry needling is really great for helping with those areas of improvement. Your neck in a good spot still, Colin?
Yep.
Cool. You'll feel a little pinch, and in some spots you'll feel a deep sensation, but to put it simply, sometimes you won't even know that I put a needle in the air, so it can be very light as well. Okay. So this is a good segue to talk about Diamondback Brewing Company. Diamondback Brewing Company is in downtown Baltimore. They're in South Baltimore. They opened up their tap room and really their first true brick and mortar, right? About 3 years ago.
Going on almost 3 years.
Going on almost 3.
2.5 years ago.
really impressive growth. The company's got great values. They have great quality product in terms of the beers that they put out. They're very good in the Baltimore area. They're really respected in the beer community. You guys did a collaboration with the new Guinness Brewing facility out in Southern Maryland, didn't you?
We did, just down in Halthorpe.
Halthorpe.
Yep, just on the outskirts of the city.
Right by the BWI?
That's correct, yep, 195.
195. You guys did some collaboration beers with them?
We did one collaboration beer with them, yeah.
Okay.
It was a dark Czech lager called Tamave Pivo.
Tamave Pivo?
That's it, yeah, dark Czech lager.
It's a solid name. Alright, so you go ahead and relax while I do this area in the neck, okay? Sometimes when we talk or when we engage the jaw, we can tighten up muscles here, and we use the neck muscles to stabilize our jaw when we're speaking. And so I just have the patients usually relax and just enjoy the process. So I'm going up the erector spinae group and the cervical spine. I'm about the C3 level at that point. We're going to stop. And then we're going to come in from an angle, okay? When the facet is irritated, we do the deeper neck muscles from an angle on the side. So we started doing dry needling in this office out of demand because it was getting such good results, especially with athletes, especially with some of the ball players. It's been really helpful in terms of soft tissue pain, as well as helping with tension in the muscles. So I'm palpating down to the corner of the scapula where the levator scap inserts right on this edge. Did you hear Dr. Jeff over there calling?
What about him?
He said, "Don't you know your wife is always right?" The lads are always right. Colin, what was that sensation like right there?
Like very dull, intense pain for about a second.
Yeah, so when we hit a trigger point, that's usually what it feels like in
You
an
hear
area.
it about twice, maybe 3 times, the higher you go up.
Mm-hmm. Working on the inner spinous space of the cervical spine. You won't have those sensations as much in this area, but it's when the irritation occurs at a deeper level, the inner spinous space becomes a little bit pain sensitive.
Oh.
There it is.
That's through the front of the neck.
Yeah. The sensation that you felt.
Yeah.
So we're going to work on this right trap here, okay? You might feel that twinge or that muscle kind of going into a little bit of a jump in this area, okay? There we go. Doing good?
Nice. It's your hometown, right?
I felt that all down through the scap.
So the dorsal-scapular nerve runs through this area right through here. You okay? And he had a pain pattern on his an exam form when he came in, similar to that sensation. It comes from the C4, C5, C6 area. So when we get referred discomfort from that joint, it can cause pain to come down to this area as well.
He did just attempt to.
We'll give him a dowel and see exactly how he does it.
Colin, you're going to feel like you had a good workout in this area today, okay? Especially with how many trigger points that we're getting with you. Another good one.
We call the office 410-296-7770. Thanks, bye.
Do you ever go to IHOP or do you like?
calling an employee or is he calling a patient?
What's that?
Is he calling an employee or a patient?
Potential future employee.
Oh, damn.
Danny is right. He should have been here.
Mm.
He probably just didn't have miscommunication. He seems like a pretty good guy. We'll see, though. The hiring process is a good process, isn't it?
How many needles total are you putting in there?
20.
How many you got so far?
Last one.
Wow. Good time.
Little pinch here. Okay, so let's go over some of the things that we found on the exam, right? So he had some pulling on the base of his skull. We worked on the erector spinae group, the trap in this area. We did the posterior lateral delt, and we did a little bit of the insertion near the where the lat comes up behind the shoulder blade. We did the levator scap insertion off of the scapula. And in terms of trigger points, in terms of response, he had a really good response. You can see some little redness around the needles. That's a good sign. I'm in an area of tension. I'm in an area where the body is responding to because of the amount of tension that he has there. It's a little bit of a blood response around the needles, which is a good sign. Okay. When I go over an injured area, or when I go over an area that's causing inflammation in the body, the needles will have that response. So he had a good response in that sense, and then he had a good response in multiple trigger points. So I'm going to let Colin relax. He probably had that kind of wave and surge of tension, and now he's kind of coming down, and I want him to relax during that process. Okay, so we're going to focus on his problem area today, and then we'll start working on some other areas that he can improve in terms of function. So we have better mobility in the thoracic spine. It allows for a more optimal situation going up further towards the neck. So if the thoracic spine is doing its job, the neck can do its job as well, in other words. All right, man. You got any questions? All right, relax. I'll be back in 10 minutes, okay?
A lot of people have been saying, we want to hear a podcast, we want to hear Dr. Warren whisper for 35 minutes straight.
That's what, yeah. We're excited about me whispering. I just sit there every night and just whisper, talking about chiropractic.
Get close to the mic and whisper.
I can't commit myself to that. I'm sorry. I just can't. All right.
All 20 out?
All 20 are out.
Wow.
Nice work. A little R&R this morning.
Yeah, I do have some.
Some beauty marks this morning.
Yep.
You know, today is the feast of St. Ignatius.
Is it really?
A Christian brother from Calvert Hall just told me.
Oh, wow.
Yes.
Is he a patient? He comes in here?
He's just leaving. So what's all these Calvert Hall people doing? He's like,
That
today
remind you of your own patron saint of your high school that you went to?
Yeah, right.
Sweet.
Yeah.
All right. So I have to lift some cakes today. Is that cool?
Yeah. So after needlework, that's a good question. People ask, can I lift? It's just like you did an exercise this morning. You stress those tissues.
Yeah.
Needling does a couple of things, so you understand it from this standpoint. It creates a soft tissue, a really tiny but soft tissue lesion in the skin. Your body responds to that
Right.
insult to the area, right? And it starts healing in that area. It brings in components that help you heal. Right? There's pain mediators that come in, and physiologically there's blood markers that come in to help heal that tissue. So it stimulates a healing process in whatever area that we heal, which makes it really powerful when it comes to promoting healing.
Okay.
Right? And then it helps from a pain standpoint. But with that promotion healing, you get soreness, right? Just like you work out really hard, working out is just a stress on those tissues. We lift 50 pounds so that the small, tiny muscle fibers have these little micro tears, so our body says, whoa, whatever we just loaded that tissue with was more than our body can handle. We need to build that up stronger.
Gotcha.
Needling kind of works in those same properties, okay? So you'll have a little soreness, but you can work through it. Basically.
Gotcha.
Yeah. So if you didn't do anything, you might not be as sore. You might be a little bit more sore if you start lifting kegs all day, but it's not going to change your treatment plan.
Okay.
Okay?
Cool.
All right, and so now we're going to go ahead and just set you up on some heat and stim.
Okay.
We're going to get that area loosened up so you're not as sore.
Okay.
It brings a good blood flow to the area. It basically kind of promote good blood flow to the area with heat, moist heat. And then we'll show you those exercises and I'll adjust you. Okay?
All right, cool.
All right, so we'll get you back into a room and get you started.
Awesome.
How are you? I'm gonna bring you over to Seth.
Hauling.
What's in your box? Whoa.
Dun, 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 dun. It's a laser in the box.
Laser in the box, yeah.
Alright. Doing it. Oh my god, I can't. I cannot.
We're gonna make so many more people feel good.
Yes.
Is this a second laser?
Yes.
No, that's the one that we keep and we're sending. Here's the heat on the neck.
Whoa. Nice.
Yeah.
I'm gonna put one on the shoulder, but I'm gonna have to kind of wrap you like a mommy.
Okay.
Mommy, for it to stay.
Yep.
With an ease band.
Okay. Can you get underneath or?
Yep. So I'm gonna go under your left shoulder first.
Okay.
Your left armpit first, and then the right one. And then one more time over on this
Yep.
side. And then you can go ahead and relax as best as you can with all this on you.
Oh, I can fall asleep like this.
I'm gonna start turning up the two on the neck first. You let me know when the stim is strong but comfortable. If you feel it, it's working, so it's whatever level you like it at.
Whoa.
Too much?
I mean, I just like tensed up a little bit, but like it doesn't hurt. Like it's,
Okay. Do you want me to turn it down a little bit or leave it there?
go. I don't know. I just feel like I always take it to the max with everything. So like
Okay, do you want to try more?
a little bit, yeah.
Let me know when.
Okay, that's good.
Okay.
Actually, turn it down just a little bit.
Is that good?
Yeah, that's perfect.
And now the two on that right trap.
Okay.
Alright. You'll be here for 10. If you need it bumped up, we'll come back in and check on you. Just
Okay.
let us know, okay?
So we're gonna pretend like all of this
We'll
is
figure it
on-
out together,
Yeah,
right?
we're all in this together.
Yep.
So this is gonna be like on a train track. So we want it just to be going forward and back. We don't
Yep.
want the chin to be going up and down at all.
Okay.
So you're gonna go out, and you're gonna come straight back in. Yep. So you should feel that tension build up right back here.
Mm-hmm.
Good, 10 times. To get like closer to the wall, so we're gonna slowly crawl our fingers up. We want to be feeling it all right here, okay? Obviously, you can step like a little bit closer each time. Try not to hyperextend your back at all. Keep those hips tucked under. If you start to hyperextend at all, just stop crawling up.
Really, your focus is your chest, so turn your chest towards the wall. Good. Keep this pinned down. So you reset yourself every time, then walk forward. Good. As far as you can comfortably go, keep going up. Good. Reset. Good. Forward. Good. Now this is where it's important, is controlling on the way down. The eccentric portion, the lengthening portion of any exercise, that's where the rehab comes in. So slowly come back, control it. Keep the shoulder down. Keep the shoulder down. This is the little cue you can give them, is just this tap on the trap. Keep it locked in. It pulls the scapula in. He's not reaching up. When we reach up like this, it closes down that glenohumeral space and allows us not to do allows our shoulder not to be a shoulder, basically. It kind of locks it up. So the cue is here, keeping the shoulder down, pinned down and in, and this is just a nice way to keep that. From this position, you're just going to crawl up nice and slow. When you get here, you can feel your shoulder coming up, set it down and back. And this is where you'll feel a little bit more of a burn or like an exercise going through this routine. And then same thing, nice and slow. Control it coming down. Okay. Good. There you go. Feel that pull from the lower trapdoors from the rhomboid. Good. Next day is just nice and neutral. Ideal. Good job. And a little bit more in, so that your wall is touching your side almost. If you can get it to that point. If it's uncomfortable at any point, you stop there and you come off. I don't want you to work through pain, but I want it to be challenging. Good.
Feels okay?
Can you tell that I'm actually not writing and I'm fake writing? Totally.
Hands on your stomach for me. Good, let it all drop. Good.
Sorry.
You were expecting
How
that.
do you guys not kill somebody?
It's right by your ears. It's just really the same range of motion. I'm not taking it any farther than that, and I'm not taking it any farther than that. But it's the quickness that I do it in that allows me to move the joints. It's a good question, though. Normal ranges of motion. It's just pressure over the joint and quick hand movements. So when we needle the area, C5, C6, around that area, especially into the shoulder, those trigger points are following along the dermal path being the skin path of that nerve at C5, C6. So when I hit trigger point after trigger point, that area is kind of a little worked up right now, and that's why you feel it in the forearm. Okay.
You always see videos of people doing it, but you don't actually, like, we don't mean to relax.
You're good.
Yeah, that's in the wrist, that's a little troublesome.
In the past, you've had wrist pain?
No, like, just then, when you, like, twisted the elbow, like, yeah. I can feel it in the interior, or exterior wrist, actually.
Turn your head this way for me. Just mobilizing the AC joint. That last little click is what you're feeling move.
Okay.
Good. Rest your hand just like this. So I block the front. This is where your sternum is right here.
Mm-hmm.
Your ribs attached to the inside right here on your sternum, okay? My hand puts pressure right over this insertion of the ribs. It allows me to get compression on the backside. So you're going to reach across and hold on to me. Good. All right, take a breath in right here. Now let it out nice and easy. Loose. All right, let it go. Let it go. Yeah, that's it. Good. Good. Turn your head towards me. Go ahead, rest right here, buddy. Reach. Take a breath in. And exhale. Keep it short, drop a little tight. Good. Really good. Good.
Why'd you get more crack on that one side than?
And a little bit lower on the thoracic spine. So when I adjust you like that, I'm manipulating not only the ribs but also the thoracic spine. So it's both sides that I'm adjusting when I do it.
Yeah, you just tend to get a lot more crack when I had my hand this way than when I had it this way.
Turn. Yeah. No, I think that it also comes down to some of the tension that you got right here.
Gotcha.
But when I adjust you on the opposite side, it manipulates all these joints.
Okay.
Okay.
All right.
Come on your stomach for me.
Gotcha.
Good. Bring your hands all the way down for me. Good. Rest right here. Good.
You got the other hand rested up there?
Yeah. Okay, take a breath in for me. Easy exhale. Good, let it all drop. No pressure. Good, loose. Good. Okay, good. So I'm just palpating the joints right around your sacrum. This is your SI joint right here.
Yep.
Here's your hip, ilium.
Yep.
That's the sacrum.
Yep.
5, 4, 3 going up. So when I palpate it, just this rotation of the sacrum,
Yep.
basically posterior tilt, just a little restricted, so that's how I'm going to adjust you on this side, okay? When you're ready, come on your side, face me. Your arm's going to come through with you, okay?
Okay.
Other side, so bring the hand right through on top. Yeah, see your line on your shoulder. There you go. And then just like this, and like that. Very good. Good. And I'll let this leg go straight right here for me. And I'm going to bring your hips into this position. This allows me to bring that joint to tension. So let the hips come towards me. You're not going to fall. I'll do all the work for you. There you go. So sometimes people are a little guarded back here.
Mm-hmm.
That's normal. Just let me do all the work, okay?
Okay.
Let everything go loose. Get loose. There you go. Get loose. Loose. There it is. Good. Feel how it's moving? Loose. Oh, there you go. Nice. On your other side for me. So maintaining good mobility in that area. If you feel like you put yourself through like a heavy bike race, you ever want to come in to get adjusted in the low back, it can relieve some of that tension very quickly. And you'll feel the difference when you get up. Now relax everything. Good. Take a breath in. Easy exhale. Good. Good. And let that drop. That's good. Come on your back for me. Relax your legs all the way. Good. Loose all the way. You'll feel distraction in the hip. Good. A little more. There we go. Good. Again. When I do this adjustment, I'm feeling the foot. See if there's any tension in the foot. Your ankles move really well. Just a little bit of tension in this midfoot here. So I'll put a little bit more pressure when I adjust you this way, okay? Loose. Feel how it kind of clicks and pops on my finger? Now you feel it in the hip, okay? Nice and easy. There we go. Good. All right, my friend. You just got your full spine adjusted. First time. You only cussed it one time. It's the F word off the bat, but just been adjusted.
Yeah. You've been adjusted, sir. All right,
man.
That was pretty cool.
Yeah, how do you feel?
Solid.
Yeah. So let's just do a little range of motion. Let's see how the neck feels, especially, okay? So with all the work thrown at you, needlework, exercise, you might be a little sore in that area. I just want to see globally how you're moving now, okay? Bring your head back for me. Good. Good. How does that feel going back? You have a little bit more end range of motion.
Tension in the right again.
Okay.
Here.
Is it pinching feeling or is it just tension?
It's a pinch.
Okay. Yeah. Go back for me. Good. Rotate this way. Any pain there?
Nope.
Good. And go back and rotate for me. Any pain there?
Just into the scapula a little bit.
A little bit? And how far down does it go?
It goes to like right here.
Okay. So we'll see how those symptoms heal over the next day, really. So in terms of range of motion, it's better. Quality movement's better in the arm. Let's just see how your shoulder range of motion is after those exercises. So nice and easy for me. Hand down by your side. Go up to the ceiling for me. Good. How does that feel overall coming up?
Just gets like harder and tighter like through the trap.
Okay.
Yeah.
Gotcha. So keep practicing those wall crawls over the week. Okay. Just twice a day is what you need to do.
Right.
The press ups throughout the day to loosen that up. Needlework, you respond really well to needlework. With what that looks like though is a little bit of soreness early on. So you're probably guarding up a little bit after the needlework too. Okay. So we'll see how you feel tomorrow.
Cool.
Yeah. We'll see you tomorrow at the
man.
brewery.
Appreciate it.
Well,
Yeah.
man. I look forward to working with you.
7:30.
Yeah.
p.m.
7:30 p.m.
Yeah. All right. Yeah. Let me know. Let me know how many staff members are coming down, and then we usually